Next disease, conjunctivitis. Conjunctivitis can be from almost any bacterial or viral origin. Viral conjunctivitis tends to be bilateral. And the reason that viral conjunctivitis tends to be bilateral is that all you need to spread conjunctivitis is a touch. Touch, touch, it spreads. You have viral conjunctivitis, you're sleeping over at someone's house, the pillow touches your eye, and it goes on to the next person. The pillow, the towel, the washcloth, or anything else that's in contact with your face can spread that viral conjunctivitis with just a touch. Now, bacterial conjunctivitis tends to be more unilateral. Viral conjunctivitis tends to be more itchy and cause abnormal lymph nodes at the ears. As in anterior to, auricular, not oral, but auricular as in AU, auricular, pre-auricular adenopathy. Viral conjunctivitis is bilateral, itchy eyes, can't get comfortable, and pre-auricular adenopathy. Bacterial conjunctivitis tends to give more of a purulent, which is to say pus, purulent discharge, thicker, creamier, richer. Single eye, purulent discharge. There is no specific therapy for a person who has viral conjunctivitis because there is nothing that will reverse that virus. So bacterial conjunctivitis is any topical antibiotic will treat that bacterial conjunctivitis. Any topical antibiotic will treat that bacterial conjunctivitis. Therefore, we don't particularly worry about whether it's topical sulfa drugs, topical tobramycin, topical gentamicin, topical tobramycin, gentamicin, sulfa drugs. We don't care if it's topical ciprofloxacin or any of them because medications that would normally kill your kidneys at the concentration that we put them into inside the bloodstream can be used topically very easily because it's not absorbed. If it was absorbed and went into your body, those level of antibiotics would cause renal failure. But topically, it doesn't get into the body and can be used in such high concentration as to kill any bacterial organism. Those viruses that cause viral conjunctivitis, like an adenovirus, we at this time, in our advanced stage of medicine in the year 2005, are so advanced that we haven't developed an antibiotic that will insufficiently kill adenoviruses, the cause of the common cold and other viral illness, such as a viral conjunctivitis, viral otitis, viral sinusitis. And the reason is that this disease resolves spontaneously by itself in a few days. Major management, don't touch my eyes. Get your own towel. Isolate my head. So no touching, and no touching anything that's been touching the eyes. This bacterial antibiotics. Next disease. The difference between conjunctivitis, an infection, and a subconjunctival hemorrhage is like night and day. If this is the sclera, and we have the lens of the sclera, the cornea, over the top of that, there is a conjunctiva. Now, the conjunctiva attaches at the juncture of the sclera, which is a $5 word for the white part of your eye. Hey, I didn't get $175,000 in debt to say white eyes. The sclera attaches to the cornea, color-coded, at the limbus. Now, where these things attach, that's where you know that the blood, when it occurs, has to stop there. That's why subconjunctival hemorrhages tend to mostly be cosmetic in nature. The management of these is largely based on their cosmetic appearance because no one wants to look like they have red eyes because it happens, one, from low platelets causing you to have a hemorrhage or trauma to the eye. Low platelets because, remember, platelet type of bleeding is superficial. The blood accumulates under the conjunctiva and it causes a hemorrhage, but it's never sight-threatening. Why? Because the juncture of the conjunctiva and the cornea at the limbus is basically not allowing the blood to go across the cornea. So if the blood can't get across the cornea, it can't be sight-threatening. Subconjunctival hemorrhages. Check my platelet count, rarely my PT-PTT. Stop hitting me in the eye, please, and just wait for it to spontaneously reabsorb. And if I was you, I'd start worrying about getting the right form of sunglasses for the next 10 days while these start to reabsorb.